Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are 2 new cases of COVID-19 to report. The total number of cases is at 308. As of this morning, no individuals are hospitalized and there's no one in ICU. As of this morning, 293 individuals are listed as recovered and there are 8 active cases. With these 2 new cases, they are household contacts. The initial case is related to travel outside of Canada. The contact within the household did have trips to the community during the period without symptoms, so very low risk situation, but public health is going to announce those locations just to be complete. This individual attended Home Depot on Bishop Grandin on June 12th from approximately 8 in the morning till between 8 and 9 a.m. And the Kenaston Walmart on June 13th between 6 and 7 p.m. So of course this individual was not showing symptoms at the time, which makes this a low risk. And the reports show that both of these locations had policies in place to ensure there was physical distancing between patrons. So this is an extremely low risk situation, but certainly reminds us that this virus is still present and the importance of those physical distancing measures that were in place during these visits. So just to stress the importance of those and to stress that this is a very low risk situation, but certainly anyone who were at those locations and were showing symptoms, just like any other Manitobans, we'd suggest that you stay home and be tested. 828 lab tests were performed yesterday, taking our total to 55,743. The Restoring Safe Services Manitoba's Pandemic and Economic Roadmap for Recovery Phase 3 plan will go live and into force on June 21st, as was announced Wednesday. It's available at manitoba.ca/covid19.ca. Businesses with questions about how the new orders apply should visit engagemb.ca. We continue to remind Manitobans that although we've done well, our numbers have been taking the right trend. Certainly this virus has not gone away, and we're going to need to deal with this virus in one form or another for quite some time. So we continue to see cases, and as we mentioned, we expect to see this. We'll continue to see cases. We can continue to be vigilant for limiting the transmission of this virus in our communities. And again, what Manitobans have become very aware of: frequent hand hygiene, maintaining physical distance whenever possible, and very important, staying home when ill. So as we continue to reopen into Phase 3, we know that we're accepting some risk, just like any other parts of our lives, but we all have to be aware of that small risk and the measures that we can take place to minimize that risk. So certainly those that are high risk of severe outcomes, those over 65, those with underlying medical conditions, those with immune compromise, need to be extra cautious at this time, extra vigilant with their hand hygiene, extra vigilant with physical distancing, avoid large, crowded, enclosed spaces. As we move forward, we can't stress enough the importance for Manitobans to stay home when they're experiencing symptoms of COVID-19, which are fever, cough, sore throat, runny nose, loss of taste, loss of smell, aches, fatigue. Stay home, do get tested, and we're going to together limit the transmission of this virus. So again, Manitobans can continue to visit manitoba.ca/COVID-19 for up-to-date information, and I can open up to questions at this time.
Thank you. Reporters on the line, you are reminded you'll have one question and one follow-up. We'll start today with the Winnipeg Free Press. Danielle.
Good afternoon. My question is for Dr. Roussin. When will Manitobans be able to access the National Contact Tracing App announced by the Prime Minister this morning? And can you tell us what is being done at the provincial level to coordinate contact tracing of positive cases and travelers from west of Manitoba and northwest Ontario?
Yeah, so we don't have details yet on when Manitoba will be on that contact tracing app, so we'll know more about that as time goes on. Contact tracing certainly doesn't only occur with COVID-19. Public health contact traces many of the reportable illnesses, and we're quite used to dealing with multi-jurisdictional issues with that. So we'll see people from out of province who had out of province contacts or may have been a contact from out of province case of, say, meningococcal meningitis, and we have contacts through various jurisdictions to notify of those contacts, to follow up. So that process has been going on right from the beginning. Certainly some of these technological approaches, these apps might facilitate some of that, would be an addition to those measures, but none of these apps will replace the contact tracing and work that's already taken place by public health.
Thank you. And just as a follow-up, do you have an idea when reporters will be able to once again attend the COVID-19 updates and the provincial press briefings in person? And why isn't that part of phase 3?
Yeah, so we're working on that, and I think it will be shortly that we'll allow that. We'll certainly take the typical precautions, ensure that there's ability for physical distancing, but that's something in short order we'll have up again.
From Global, Marnie.
Good afternoon, Dr. Roussin. Marnie Blunt from Global News. We're hearing from restaurant owners a fair bit of a confusion regarding some of their new guidelines. You have been clear about the 2 meter or 6 feet distance between tables, but when it comes to the permanent or temporary physical barrier, I think there's just some confusion over what those barriers should look like, how wide they should be, how tall they should be. Can you just provide some specific advice to restaurant owners on what those physical barriers should look like?
Yeah, so we're actually working on that today. So we're going to have something out very soon to operators for that. And so this really arose from the consultation process that we underwent, and we wanted to increase the capacity for restaurants. We thought it was safe and prudent to do so. So we increased that to 75% in our initial draft plans. We heard back from the Restaurant Association that this really didn't help them all that much. So we found some other creative ways to allow these barriers to be up to try to get to their capacity increased. And so we're going to be sharing some details shortly on what that could exactly look like.
Thank you. And my other question just regarding indoor recreation facilities, that some of them, they're now allowed to open. Movie theaters aren't included in that. Can you just explain why movie theaters aren't included, even if they did have, the proper hygiene protocols in place and physical distancing throughout the theater?
Yeah, so it's really the nature of the contact there when we're talking about theaters and such. So we have close, prolonged, enclosed contact. So the 3 factors that this virus spreads in easily. So when we're talking about shopping malls, retail outlets, even these indoor recreation outlets, there can be a lot of people, but no one's beside each other for prolonged times. These are brief interactions where people are walking by each other or beside each other for short periods of time. So it's not the same as that close, prolonged, enclosed contact.
From the Brandon Sun, Bud. Bud. Moving to the Winnipeg Sun, Scott.
Hi, Scott Billick, Winnipeg Sun. Question for Dr. Roussin. You say that the new cases are close contacts of a previous cases. Do we know why these close contacts were out in public? knowing that I guess they're living, assuming that they're living with a confirmed case?
So the cases that I announced today is there two household contacts. Neither of them were known contacts of a previous case. One of them had recent travel and was self-isolating at home, and the other one was out while they were asymptomatic and later tested positive. So that's neither of them were known contacts of the case.
Okay. And restaurants are saying, for my follow-up, restaurants are, they say there's no difference between 75% and 100% when it comes to their establishments because of the 6-foot barrier or the 6-foot requirement between tables. And then they're also saying that, putting up barriers is going to cost them thousands of dollars. Is there not, it seems like some restaurants have come to us with some plans, different options and stuff like that. I guess, is this the only option for restaurants to put up barriers, or is there other things that they could do, like take temperatures before coming in the door, or that sort of thing and stuff?
Yeah, so I mean, unfortunately we've seen super spreader events in restaurants, and so we know that this is the situation, right? Close, prolonged, enclosed contact. This is what is high risk for transmission of this virus. Now, if you are 2 meters away from the next table, then that risk is substantially minimized. But if we have those tables within that time, that's increasing the risk. So that's where this 2 meters comes from. That's why we've been able to open restaurants, because we know if we can separate those tables, then we're minimizing the risk. Or, like we said, we heard back that a 75 doesn't do much. So certainly things like in booths, there's no need to open up every second booth. Every booth could be open the way they're situated, but there just needs to be a reasonable barrier between the booth beside them. So these are things we're trying to come up with to be able to increase the capacity of the restaurants, and at the same time keep it safe for patrons. So patrons going to restaurants where there's 2 meter separation between tables or adequate barriers, the risk is very minimal in those situations. If those tables are closer, then the risk of being in contact with someone is increased. So these are what these guidelines are come from. But from what we learned about this virus, what we learned about higher risk situations. So this is here to protect the health of the public, protect the patrons at these restaurants.
CBC Radio Canada, Catherine.
Hi, Dr. Roussin. This is Catherine from Radio Canada. Just wondering, do we have a confirmed number as to how many people or how many positive cases there were directly related to truckers and the trucking industry?
Yeah, so don't necessarily have a total there. We know that we've been reporting on a number of them. These new cases are not related to truckers, but we had previously reported last week a number of them, and then some the 3 cases over the weekend were in fact close contacts to one of those known cases that was a truck driver. So certainly we know that travel outside of jurisdiction, especially internationally, is a common source of infection in Manitoba.
And just as a follow-up, is that something that we should be concerned about, especially considering that they're exempt from this 14-day rule?
Yeah, so we've been concerned about it at the beginning, right? And all of this is about a balance of risks, right? We need to be able to keep our supply chains open. Food, PPE, all these things are brought in this way. So if we mandated a 14-day self-isolation for every time a trucker left the jurisdiction, those supply chains would be compromised. So we need to accept some level of risk to keep those things going. But we've communicated with truck drivers to very closely monitor symptoms to avoid large group settings during any of this time. And we've also opened up to asymptomatic testing, certainly voluntary for truckers. So we've been concerned about this from the beginning. We have measures in place to reduce that risk.
From CBC Manitoba, Aidan.
Good morning, Dr. Roussin. I'm wondering if you can provide any more information on the individual who traveled internationally. Can you tell us where that person traveled and if it was for professional reasons?
Yeah, I don't know the reason for traveling. It was to Europe on this travel. So, but I can't speak to the actual purpose of that trip. I'm not aware. It's not necessarily relevant, but I do know it was from Europe, and symptoms developed within the incubation period after return home. Although they were self-isolating, but did have that one or two household contacts, one of which tested positive.
Okay, thank you. And can you give us any more information on the two new cases that were announced yesterday? Were they linked to any known cases or travel, or were they, and also were they linked to each other?
You're right. So they were household contacts as well. One of them was asymptomatic. The other case, we were unable to definitively link to travel or to a known case, but there was no significant community exposures that we could find.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Following up on Aiton's question, you just mentioned that one of the cases announced yesterday there's an unknown source of transmission at this point. Is it believed to be community transmission? And are you concerned about a rise in community transmission?
So that's, as of right now, that would meet our definition of community transmission. We haven't found a link to a known case, or can't link it directly to travel. So that's something that we will likely classify as a community-based transmission, although we do follow up for days continuing to look for these links. And so although we don't really have any significant community-based contacts that we could identify. So likely community-based transmission, although we don't really have a lot of contacts that we need to follow up on.
And my follow-up is, have you had any cases linked to some of the large outdoor gatherings that we've seen in recent weeks?
So if you're asking about the peaceful protests, then no, none of our cases have been linked, and we do inquire about all these type of gatherings that people have been to. So none of these cases we could link to a large gathering.
From CTV, John.
Just to follow up on Steve's question, in light of the fact that there were so many people at that peaceful protest, thousands and thousands, I'm just wondering what that says about the need for crowd size restrictions in an outdoor setting.
Yeah, so we definitely know that the outdoor setting provides less risk of transmission. So certainly group sizes are larger allowably in the outdoor setting. Just because we don't link anything yet to that demonstration doesn't necessarily mean that there's no risk in those type of settings. So we still recommend people physically distance whenever possible, follow the group sizes, but certainly outdoor contacts are posing much less of a risk than the enclosed, prolonged, close contact.
Thank you. And on a different topic, it just seems that so many of our recent positive cases have been related to traveling. I'm wondering if it would be beneficial to test everyone who crosses the border.
Yeah, so remember that the value of asymptomatic testing is quite low. So a negative test in a person without symptoms does not carry much value. So the negative predictive value, as we call it, is quite low. So it doesn't do anything about the incubation period. So this virus can incubate for up to 14 days. Certainly, the majority of people would have symptoms within that 7 to 10 days after exposure, but can be up to 14 days. Having a negative test at day 1 or 2 doesn't mean you can't develop this infection at day 7. So asymptomatic testing has very little value. So we've been doing it targeting. We've been targeting, say, the truckers, but again, voluntary, because it's not of high value. We're not going to make that a mandatory test. And then we still do it in some surveillance just to get a sample of our of the population to see if there's any community-based transmission that we can pick up on. But we've done over 4,700 of the asymptomatic tests and haven't found a single case that way.
From City TV, Jonas.
Good afternoon, Dr. Roussin. Just touching base on the potential of the American border reopening. We're seeing some calls from groups to maybe push that forward. But given the response both of the border at the federal level, some of the states, I mean, what's your anecdotal thoughts on reopening the border?
Yeah, I think it's again balancing risks. Right now, we know that there's a lot of community-based transmission happening in many of the states, and so that would pose some risk to Manitobans. So we'd need to find a way to reduce that risk should we move forward with that. So I think that the extension of those restrictions were in line with what I would recommend, and so we'll continue to follow it over time, see what the transmission does in upcoming weeks. But as long as there's widespread community-based transmission, we need to be very cautious to allow freely people traveling in and out.
Just to follow up, I guess, your general thought on this is that, I mean, until they get it under control, I mean, we can't really open the border?
Yeah, I think, it's probably the way that we can best reduce our risk. But remembering that everything is a balance, right? There's a lot of benefits to open borders, and that this virus isn't going away anytime soon. So it's not like if we just hold on for another month, then we'll be all good. It's not going to be like that. We need to deal with this virus for for the foreseeable future, and so we need to find ways to live with the virus, and we can't live in a lockdown forever. So there's a lot of balancing that goes on in these decisions.
Coming back to the Brandon Sun, in case there were technical issues. Bud, are you there and do you have a question?
I am here, and my technical issue is called a mute button. Yes. Quick question, Dr. Roussin. This is the time of year, as you know, for seasonal allergies. I was wondering if you have any concerns over people rushing to get tested for COVID-19 when they've got hay fever, and any advice you could give to people on that subject?
Yeah, and so these are some of the concerns that we had when we opened up to all symptomatic Manitobans. We know it's allergy season, so we sure didn't want to be overwhelmed with people showing up for testing that are going to have a very low likelihood of testing positive. So our advice are people who have very typical onset of symptoms, and their symptoms are very typical for what they have and responding to their allergy medications, and this is very low risk. But at the same time, our messaging is if you're not sure, get tested. If you're not sure, make sure you stay home and make sure it's not COVID before going to work or to school. So there's no black and white. There's some gray area, but the messaging would definitely be if you're not sure, be extra cautious, get tested, and make sure before concluding its allergies.
Okay, and a follow-up on a slightly different subject. Regarding casinos, I imagine there's the same rules for the same reasons, but to my thinking with casinos, I don't see any reason why VLTs and such could not be blocked off 6 or 12 meters apart. They do in restaurant restaurants, and that sort of thing. Why can't that happen there?
Yeah, so I think there is opportunity. I think we can get some plans in, and then we can review that. So it wasn't part of phase 3, but it's something that's still on the agenda. We're still looking at it and looking at ways to come up to safely allow operations again.
Okay, that concludes our first round. We have time for a few open questions. Reporters, please introduce yourselves and ask your questions now.
Dr. Roussin, Scott Dillon from the Sun. There's a bunch of churches, I think there's even a petition out. Churches are, essentially, I guess, demanding or at least wanting to set their own rules and to gather. What is the message to to, churchgoers, faith-based communities, that sort of thing?
Yeah, so we certainly understand the importance of this, and we've engaged from the beginning in trying to find creative ways to allow for this. So early in the phases, we had the drive up services being allowed. In phase 2, even though the indoor group sizes were 25, we said, well, you could have as many groups of 25 if it was in different rooms. Group 3 or phase 3, it's 50 indoors, but we're allowing cohorts of 50 up to 30% capacity with no cap on that, no hard cap on that. So we're trying to do things to get some of these services going. We realize how important it is, but we know we've learned a lot from this virus, and like we said, it's the close, prolonged, enclosed contact is where the risk lies, the biggest risk lies with transmission of this virus. And so we've heard things like that malls can open and things, but this is not the analogy that we're looking at. In malls, we have just brief interactions between people. The real analogy are such as theaters, which we haven't allowed open in phase 3. And so we've worked with these faith-based organizations, and we've really tried to come up with some creative ways to allow more and more access to indoor services for them, and we're going to continue to do so. But this close, prolonged, enclosed contact is where the risk lies with this virus. So we're going to continue to protect Manitobans, and we'll do what we can to work with them and try to find ongoing ways to get something that they really can work with.
Aiden Green from CBC News. I'm wondering, can you tell us more about the rationale and your thinking behind choosing Terrace Bay as the limit for Northwestern Ontario self-isolation requirements being lifted?
Oh, sorry, I didn't catch that.
Sorry, could you tell us more about how you decided on Terrace Bay as the limit in Northwestern Ontario?
Yeah, so we just looked at the epidemiology and looked at a few geographic factors. So we just wanted to include Thunder Bay, and so in previous orders where we say up to say a certain location like Thunder Bay, then we'd always get questions. Well, is it the center of Thunder Bay? Is it the westmost point? Is it eastmost point? So we just picked a location that was east of Thunder Bay, so it was clear that up until Thunder, including Thunder Bay, was included.
Dr. Roussin, how would you, I'm sorry, I was just wondering how you would know if someone is from beyond Thunder Bay. How, are you going to stop vehicles and ask people where they're from?
Yeah, well, we've had these travel orders in place for quite some time, and most people follow public health rules. And so there's lots of people flying in from other jurisdictions, and we necessarily wouldn't know about that, but we rely on people to follow public health advice. And for the most part, that's what we've seen. When we've seen these travel-related cases, they've been isolating. And so we're going to continue to rely on that, and but we hold people accountable if they violate these rules.
Danielle here from the Free Press. Dr. Roussin, can you explain what sort of extra considerations are required for opening the casinos as opposed to VLT lounges? Like, what is going on behind the scenes that is making it take a little bit longer?
Yeah, well, I mean, I think that is just if we look at just the grand scale of the casinos and just how many patrons could possibly be in there. So I think that's the type of thing that's going to just take a bit longer to work out, just to ensure that we have a real solid plan on there, which no doubt I think there can be a solid plan that goes. It just didn't make it into phase 3. So with all these phases, we have always been receptive to hearing plans, to be looking at them closely, and then we're doing things in a phased approach. So just like before, we haven't opened everything. It's not a return to normal, but we certainly have casinos on our mind and how we could move with that safely.
Hi, Dr. Roussin.
Go for it.
Okay, I'll go. Dr. Roussin, I'm wondering, I know you've touched on this in the past, but wondering if you're giving any more consideration now or any further thoughts on lifting self-isolation requirements for people who are able to travel directly to Manitoba from places that may not be contiguous but do have good epidemiology, such as like maritime provinces.
Yeah, and just like everything else, we continually give considerations to these. For the most part, we've done things in an incremental way, and that phase 3 is no different. So we've lifted these travel plans. We did it with a contiguous fashion. We're still looking at places like the Maritimes, where their numbers would certainly be conducive with us lifting that order, and that's something that we'll do in again an incremental fashion, and even looking at the rest of Canada as those numbers continue to improve. We'll be reducing these restrictions as appropriate.
Dr. Roussin, Scott Billick from the Sun here again. Just to clarify, so today's 2 cases are related to household contacts of a case. Is that correct?
No. So these 2 cases, the 2 cases today, are household contacts to each other. One of them traveled back from Europe.
Okay, but one of them also left the. I'm just trying to understand. So when did the one leave? So I'm assuming the one that didn't travel is the one that left and went out to like Home Depot or Walmart.
That's correct. Yeah.
Is that allowed?
Well, like ideally when people are self-isolating, if they self-isolate at home, you shouldn't really have close contact with those at home. And then if you do, then those people should essentially be self-isolating. So it's not the ideal situation. We don't necessarily know what occurred there, but ideally if you're self-isolating at home, you should really not have any close contact with anyone else that's in there. So it's hard to say what exactly happened here, but we do know that the person who did the traveling was self-isolating the whole time, got tested. So did this contact who got tested, and actually was asymptomatic at the time. So was out and about when they're asymptomatic. So very low risk, and for the most part, the self-isolation of the traveler went as we would recommend.
Thank you.
Hi, sorry, Aiden from CDC. I just wondering if you can provide any more clarity on the point in the phase 3 plan regarding outdoor venues. I know that there was a line saying that for some outdoor venues without clear capacity, it may require the use of reasonableness. I'm just wondering what you see as reasonable in the context of an outdoor venue and determining capacity.
Well, that's right. So, I mean, this is we put the burden on operators. If you want to organize a large outdoor event, need to be isolated from each other, and maintained isolated from each other, which is will hold people accountable to ensuring that occurs.
And thank you. This concludes today's briefing.
Thanks.